Hey everyone, and welcome to COVID-19 and athletics and the impact on collegiate sports and exercise. My name is Kristen Hewitt. I'm a sports television reporter here in South Florida, and I'm very happy to be your moderator today. With COVID-19 sweeping the world in 2020, there remains a lot of questions about the safety of returning to organized sports and recreational activities. And we have a superb panel of experts today who are going to answer all of your pressing questions about resuming to play. So I would like to introduce them now. From the Memorial Sports Medicine Center, we have Dr. Christopher Ramsarin, a family and sports medicine physician. Hi, Dr. Ramsarin.
Hi, Kristen. How are you?
Good, thank you. We also have former college football player from Central Michigan and orthopedic surgeon, Dr. Marvin Smith. Hi, Dr. Smith.
Hello, Kristen. Thank you.
No problem. And Elise Carlson. She is the head athletic trainer at Florida Memorial University. Hi, Elise. Thanks for being here.
Hi, thank you for having me.
We really appreciate you guys giving us this time because this is such important information for our community as we try to resume a little bit of normalcy as it comes to athletics. So let's start with Dr. Smith. Dr. Smith, if you could just talk about what the Memorial Sports Medicine Center is and who you traditionally treat.
Absolutely. So we are very happy to be the first and only fully integrated multidisciplinary sports medicine program in Broward County. The Memorial Health System always felt that Broward County really deserved its own. And we have a full team of not only orthopedic surgeons like myself, but primary care physicians like Dr. Ramsarin, physical therapists, athletic trainers. We even partner with a sports psychologist, and we have a neurologist that helps run our concussion program. So we take care of elite and professional athletes, college athletes with the universities that we cover, as well as weekend warriors and the fitness community and everyday active people, and even including those who are active as a part of their job or occupation.
Wow, that's quite an overview. And Dr. Ramsarin, it sounds like you're treating more than just the body, it's the mind as well. So what makes your program different than other programs here in South Florida?
Right, and that's exactly it. We don't treat patients just as a disease. We try to get to know them as much as we possibly can. A social history is a very important thing to take prior to treating a patient, just to know what environments they're in, what they're exposed to, and what illnesses they're predisposed to as far as what their particular sport of interest is. So we use, as Dr. Smith mentioned, a multidisciplinary approach to treating an individual.
Wow, that's excellent. And I know we're going to talk to Elise in a second at Florida Memorial University, but Dr. Smith, talk about how you work with local colleges, because this is unique.
Being a South Florida native, it really has been an honor to be back in the area and taking care of some of the local colleges and universities, with Florida Memorial definitely being our flagship university. And we work very closely with the athletic trainers, such as Elise. We are in contact multiple times a week throughout the week, making sure that we're communicating any of the issues or concerns that arise with student athletes. We provide the pre-participation evaluations to make sure that they are fit for collegiate athletics. And as any injuries come up, we definitely expedite our evaluations or any imaging studies that need to be obtained to further their treatment.
Sounds like you guys are very busy, and I know Elise is very busy down at Florida Memorial University. So Elise, I'd like to switch over to you and kind of talk about how you're managing this to return to sports now, especially college football now in the COVID era.
Yes, it's definitely trying times, but we are doing everything that we can to ensure the health and safety of these athletes. We have developed an emergency action plan to follow step by step in case one of our athletes does contract this COVID-19. Also, prior to athletic participation starting, we also did gateway testing. So my team and myself administered nasal swabs, sent it off to a lab, and we got the results by 48 hours. So if athletes came back abnormal or inconclusive, or if they tested positive, they had to quarantine, until either the test results come back, or if they tested positive, then they have to follow the CDC guidelines and then retest after the 14-day period. So we're doing everything we can to keep these kids safe. I get calls from parents all the time. What are you doing to help ensure the health and safety of our child? Everyone at this university is taking it very seriously.
So let's go into that. What are you saying to parents? Because football is a contact sport. So, and I know it's difficult to eliminate all risk, right? But what are you doing to try to keep that risk low as these guys get back to the field?
So one of the things that the NAIA mandated is the daily symptom questionnaire. So each symptom is rated a different point system. So if you have a fever above 104, that's 3 points. If you have a new shortness of breath, so not related to asthma or any pre-existing condition, that's 3 points. If you have a new loss of sense of taste or smell, that's 3 points. And then other symptoms are 2 points or 1 point. So there's a list. The kids go through the symptom questionnaire. They basically label yes or no. We go through the symptom questionnaires every day prior to their participation. If any athlete scores a 2 or more, they have to go back to their dorm, and then I contact Dr. Smith or Dr. Ramsarin, and I'm like, I need another medical consult. So basically, they have to stay in their dorm, and most, if it seems like it's COVID, they'll be retested, and then after that, they have to be cleared by the by the doctors here. So if they feel that the test needs to be administered, we can do that here on campus. Otherwise, they can go to other off testing sites if they are commuters. So some kids that are not staying on campus, the university does not allow them back on campus, obviously, just to protect everyone else that is on campus. So they would have to get tested outside. But if the kids are in the dorm here, we can administer the test for them. And then if it comes back negative and then they're feeling better, we just have to wait on medical clearance from Dr. Ramsarin or Dr. Smith.
Sounds like you guys are talking quite frequently, the three of you, working very closely together. All right, you talked about that emergency plan you formulated, Elise. If you could just kind of take us through, let's say you do have an athlete that tests positive for COVID and he's been around the other athletes. What's the plan?
So that plan is to immediately isolate that athlete. We do have quarantine dorms on campus. So there's a chain of command I have to follow. I have to first talk to my athletic director, and then he informs university personnel that's in charge of the dorms. So then they have to relocate the athletes to the quarantine dorms. And then from there, if anyone else has been in close contact with this athlete, they will also be put into isolation as well and retested to see if they, probably not, but if they contracted the virus. So basically just taking every step possible. Also where the athlete has been, the university uses the electrostatic cleaner that has I believe it has a 12-hour killing period of the coronavirus. So they'll clean the dorms, they'll come to the wellness center, they'll clean the wellness center, which is where our athletes participate, I'm sorry. So they'll clean a wellness center, they'll clean the athletic free room, they'll clean the offices, they'll clean the weight room. They'll do that, that night as soon as they hear of a positive case.
Wow, it sounds like you guys have done a ton of preparation and planning to be ready for what you could have thrown at you. Dr. Smith, how does what Florida Memorial University is doing differ from other national sports programs, or does it?
So I would say that it does not differ significantly. At the Memorial Sports Medicine Center, we really pride ourselves on providing that same high level of medical care and attention to our local colleges and universities, being that many of us have our background and our training at other larger Division I institutions. I've also been extremely impressed by the Florida Memorial athletic training staff and their whole institutional approach to the COVID-19 pandemic. It has absolutely been on par with anything that I've ever seen as far as a coordination of a systematic plan at any other institution or other university. So the standard is the same. The standard is absolutely the same to provide the absolute highest level of care and attention for these student athletes.
Yeah, that's great. And I would like to talk a little bit further about people that perhaps aren't playing organized sports, right? Like maybe it's even recreational. What are some of the risks associated with different sports? We'll go to you, Dr. Ramsarin. For example, what is the safest sports to play right now in the era of COVID, in your opinion?
Right. So, being a novel virus, the information that we have available is evolving on a daily basis. What is known right now is that outdoor sports are safer than indoor sports. And some of the things that would increase your risk for exposure to the virus would include the number of participants that are participating in that sport, the time that they interact with each other, how close they are, and whether or not they're sharing any sporting equipment. So things like wrestling, obviously, a close contact sport. It's usually performed indoors, so that would be a high-risk sport. Sports that are played outdoors with limited number of athletes at any one time would be a little bit safer.
And what about in terms of recreational? And I don't know if Dr. Smith, you want to add in anything, or if Dr. Ramsarin wants to take this, but what about recreational sports? What about people that just work out on the weekends or go to a soccer field?
Right. Again, if it's something that's outdoor, it does reduce the exposure as far as contracting the virus, as well as the number of participants. Dr. Smith, I'm not sure if you want to chime in on that as well.
Really, those are truly the recurrent themes. And I would also add for those that are seeking to do certain activities, particularly our fitness community here in South Florida. People are active year-round. People are active later in age, later in life here. People like to maintain their fitness. So maintaining physical distancing, wearing masks when feasible, understanding that when the heart rate gets up and the respiratory rate increases, that often can preclude mask wear. But avoiding indoor facilities that have a high capacity of people, where people aren't really staying distance, are the recommendations.
So you just mentioned masks, which is great because I was curious about that. So for those recreational athletes, let's say you're a runner, aren't masks necessary down here in South Florida right now, outdoors? What is your recommendation on that?
Yeah, sure. For people who are running by themselves, I think it's very difficult and uncomfortable to wear a mask. And your risk for exposure at that point is somewhat limited. You have to understand that the mask itself is worn for two different reasons. One, if you're at risk for exposing someone else, the mask is predominantly used for that. It's to prevent you from spreading the virus to someone else. It does offer protection for you if you're exposed to someone as well. So if you're running out on your own, then the use of a mask is somewhat limited, and you can feel comfortable doing that. But if you're running in spaces where there are a lot of different participants there, it might be advisable that you do wear a mask if you're in close contact with that person.
So when are masks safe and effective? And any of you can answer this question. What sports or what activities would you say you need to wear a mask?
I mean, I would say, anything with close contact. Like Dr. Ramsarin said, it's to help protect yourself and to protect others around you. So if you're within that 6 feet, the CDC guidelines, I would consider that to be close contact.
So that would apply to gyms as well, right? Dr. Smith, if you're working out indoors, if you go to the gym before work, after work on the weekends, if you're 6 feet away from someone, do you need to wear a mask? Or only when you're in close proximity indoors in like a gym?
You should absolutely be wearing a mask if you're in close proximity to someone within 6 feet. There are even some studies that show that there are, spread of respiratory droplets beyond 6 feet. So I really would encourage people to even consider that 6 feet rule of thumb as a minimum and not a maximum. Also, to Dr. Ramsarin's point, he alluded to this earlier, it's not only just the exposure, but it's also the duration of exposure. So the CDC also describes something called like a blow-by, where, if two people are even out just walking or versus jogging, and they're just really kind of passing, there is a risk of exposure, yes, but the risk is definitely lower as opposed to if two people were jogging together and they were in the same proximity for a more extended period of time. So the duration of exposure is something that we definitely have to keep in mind. And one of the things that we're encouraging for our athletic population, our student athletes and our competitive organized sports, are using masks especially in scenarios where the heart rate and the respiratory rate isn't up. So a lot of sports involve lower activity components, such as walkthroughs or team meetings or things of that nature, where maybe you're being somewhat active but not a high intense activity. Those are definitely important opportunities to be wearing masks to lower everyone's risk of exposure.
Yeah, and thanks for clarifying that. I think that'll help the viewer watching now who wasn't sure when and if they should be wearing a mask in different scenarios. I want to move on to what you guys are seeing in the office right now. Are you seeing any new types of injuries right now with COVID? Maybe people who had stopped working out and are going back to sports. Is there anything you're seeing?
Well, in my office, I don't see, I'm not seeing a lot of different injuries per se, but what I'm seeing is patients who typically suffer from headaches are having more severe headaches, especially if they tested positive for the virus. And also just anecdotally, what I've seen in the office is patients who suffer from anxiety are having worse cases of anxiety now. And those who weren't previously diagnosed with anxiety, anecdotally, it seems like just the fact that they're quarantining now increases their symptoms of feeling anxious.
Yeah, it makes sense. I mean, we're living through a pandemic, so I would see that makes sense. What about you, Dr. Smith? In terms of sports injuries, are you seeing anything in regards to people, returning to athletics too quickly or anything like that?
I haven't seen a specific trend as it relates to that. With respect to sports-related injuries, I have seen more home-based injuries where people are finding more time to spend at home and possibly getting to that to-do list that they've been putting off. And we see those types of injuries. Some of the work-related injuries, we do have a tactical athlete or occupational athlete program. Many of our patients are physical in their work. But because a lot of people are not working because of the pandemic, there has been a slight decrease in some of those injuries.
That's interesting. So be careful on the ladder, folks, if you're getting up there to get the roof ready for a hurricane that might be coming. All right, a lot of people look to medical experts and sports trainers to know, what's the right thing to do. They want to know, are you sending your kids to school? Are you wearing a mask? So I would like each of you to kind of just share personally what you're doing. Are you playing team sports, Elise? Are you working out? I know, Elise, you do CrossFit as well. Are you wearing a mask in the gym? If you could each just share what you do personally, it'd be interesting to hear how you're handling sports in the pandemic.
Yes, so I do CrossFit. I also coach it part-time. So I do wear a mask. It's a indoor facility, but the doors on each side open up. It's like a little warehouse. So, I mean, there is open air flowing, but if you're inside the gym, yes, I wear a mask. And there are times where I can't make it finish the workout because I have to step outside and breathe. But I know that I'm just trying to help protect, myself and then my other gym mates around me. So I know the importance of it. But if I get a chance to slip at a spot outside, I try to take advantage of that as much as possible.
All right. What about you, Dr. Smith?
So I've definitely transitioned to home-based workouts for myself, which has actually been a blessing in disguise because I found myself to be a little bit more consistent with that than I was previously making it to the gym. So the home-based workouts, a lot of body weight activities, calisthenics, also implementing stretching as a part of my routine has been very, very helpful. And being by myself in my garage with my bands and my mat, obviously is an extremely low risk to myself or anyone else. All
right, love it. What about you, Dr. Ramsarin?
Yeah, so I play golf. I play it poorly, but I still play. So when I do go out, because it's an outdoor sport, there's limited close contacts. So, that's a sport that I choose to play that I think is relatively safe. But when I do go out, obviously I wear a mask when I'm in the pro shop. When I'm on the tee box and when I'm on the greens, I wear a mask. I have a hand sanitizer, and before I get into the golf cart, even though they do clean the carts, I'm a stickler for details, so I bring my own hand sanitizers and wipe the cart down before going in. As far as back to school, my daughter is in vet school right now. She had the option of doing remote learning, and so we encouraged her to choose that option. So she's at home with us, and she takes classes online.
It's so much fun, isn't it? All right, Dr. Ramsarin, if somebody is watching and they might have a little cough, or they're just not feeling well in regards to COVID, when would you advise someone to go to a testing site and get tested, and what's the procedure? Are you calling your doctor first? Are you going to a testing site? What do you recommend?
Right. So here in South Florida, we have a lot of different drive-through sites for testing. And typically when patients call and if they're having symptoms that are suggestive of the virus, I would encourage them to get tested. If they've been in close contact with someone who's known to have the virus, I also recommend that they get tested and also self-quarantine and follow the CDC guidelines. Most of the urgent care centers will also have some capacity to test for COVID-19, but the main option that I've done is I've suggested that they use the drive-in test site. There is one at CB Smith Park that Memorial has partnered with the National Guard in supporting, and so that's the main site that I've referred patients to.
Excellent. And Dr. Smith, if any colleges want to work with you, how can they partner with you?
Absolutely. So we work with the local colleges and universities here. We're always pursuing growth. So any college or university that is interested in looking to the Memorial Sports Medicine Center as their official team physicians, they should contact us. I would direct them to our website where they can find more information about us at mhs.net/sportsmedicine. And they can find out more about our program and exactly what we do and what we offer, both from a preseason screening and evaluation for game coverage and support throughout the season, expediting those appointments and workups, because we know in college athletics, time is of the essence. So we really try and achieve a quick turnaround as it relates to responding to injuries and supporting our student athletes.
All right, before we go, I just wanted to ask you guys if you had any closing thoughts, or if there's anything you'd like to say to the community that's watching that may or may not be participating in sports. Maybe people have holed up in their houses and they're not getting enough exercise, or they're not taking care of themselves. What advice would you give to the community?
This pandemic has been difficult for everybody, some more than others. I feel that exercise is the best way to help relieve that stress and just to help maintain that mental stability. So even if you start doing something, if you go for a walk, start with a walk around the block, then you start to gradually build up. Or, if you have 2 water jugs, 2 water gallons, you use those as, like Dr. Smith works out at home. You can use those. You can do squats. You can do bicep curls. You can do presses. Just something just to get that stimulation. I believe that's a way to help maintain your sanity throughout this pandemic and this difficult time. There are days that, I feel tired as well, and I don't feel like working out, but I just get up and do it, and I end up feeling better afterwards. So I would suggest to athletes just try to get the blood flowing in some way. It doesn't have to be strictly exercise, but if you like to go out and play with your kids in the playground, that's functional fitness right there. So anything you can do just to get your mind off it for a bit.
Absolutely. Dr. Smith, Dr. Ramsarin, do you have anything to add? I
wholeheartedly agree. Particularly in these times, exercise gets the blood flowing. The body releases endorphins. It really, we are designed in that way that our bodies and our minds are connected. So it's an important component of our overall health. So I would encourage people to also spend some time outside, because a lot of us, some people aren't working the normal hours that they would usually work, or engaging in some of the activities that they usually would engage in. So, getting out of the house, getting a change of scenery, getting fresh air, but again, doing so safely, following the CDC guidelines. As we have found out, COVID-19 is a very serious virus and a very serious condition. So we do have to continue to take it seriously, but maintaining a balance, maintaining our mindfulness and our health, both mentally and physically.
Yeah, I echo those sentiments as well. We should at best try not to politicize the coronavirus. We're all in this together. do your part in minimizing your exposure and exposures to others. The more compliant we are with the CDC guidelines, the faster we'll be able to get back to our normal lives.
Absolutely. And wear your mask, right?
That's correct.
Don't be afraid to wear your mask. All right. Well, thank you to all of you. Elise, Dr. Ramsarin, Dr. Smith. There you go. He's got his mask. Everybody show your mask. We appreciate you guys taking the time with us today. Thank you so much.
Okay. Thank you, Kristen.
Thank you, Kristen.
And for all of you watching, thank you as well. If you're an athlete or if you play sports or a weekend warrior and you need an evaluation or appointment, you can contact Memorial Sports Medicine Center at 954-265-8326 or visit the website mhs.net. Thanks so much for watching. We'll see you next time.